All right, thank you for staying with Citizen TV. Let's see some of your feedback at Trevor Mbija at Citizen TV. Kenya is the hashtag Monday Report. Let's see what you're saying in this discussion as we now look for the solution going forward. How can this be streamlined? And you say strike by the healthcare workers poses a threat to the health of the nation, putting the population at acute risk of health tragedies. The relevant government authorities must therefore move with speed, engage the practitioners, and set out amicable ways out. All right? See what else you're saying. Babu Michael says, knowing very well the effects brought by health workers' strike, the responsible government should not wait for it to occur. I feel that because most of the leaders do not feel the effects directly, they seem not to care. Okay? Muga says, Trevor, it's so sad that Kenya Kwanza government is busy creating positions and appointing political loyalists as CASs while we have over 4,000 unemployed doctors, yet our doctor-to-population ratio is pathetic. Very wrong priorities. We need a paradigm shift. Okay? Ras Bashir says the best solution in the health sector is to take back the health sector to the national government. Counties have really failed. Okay, that's the conversation you're coming to just now. Agumba Steve, there are two important sectors the government shouldn't dare joke with: education and health. These stalemates should be solved to enable our country forge ahead in health. Chest thumping and hard stands will solve nothing, but rather more graves will be dug. Let's sit and talk. Okay? All right. Governor, there's that conversation that gov't has brought up. Is that a possible solution to revert these functions to the national government? Because he says counties are small.
It's laughable. Yeah. It's laughable because we are talking about, the shape of a balloon. If you press a balloon where you've made a dent, it protrudes on the other end. There is no money for national and county governments. It's the same kitty. We draw from the same basket. So if he wants to return, or is wishing for the health services to be returned back to the national government because of resources, I don't know where those resources will come from. Because the funds that were meant to pay health workers are devolved to the county government. What the national government is left up here is just for policy making and definitely looking at the standards and those kind of things, and also coordinating. So unless there's another reason to return the health service back to the national government, which of course the Monanchi voted in 2010 very overwhelmingly that they would like that service to be devolved, and we can see fruits of the same, then it's a wild goose chase. Because there's no national and county government has come to the decision of whether to increase salaries or not, whether to pay more or not. In fact, you're better when you're the county government, because we have 47 county governments. We are not saying that there are some that are reasonable. We could be at different rates with a very small margin. And it is even better now when you're having some counties with very high standards and others medium level standard. Even if you try to go back to the national government, you see the same way they delay our resources. Like now we are 3 months behind. We have not gotten disbursement for December. We have not gotten disbursement for January and for February. Now we are in March, all right? And us, we have a voice. We have a very strong voice because we are backed by the Constitution that says this amount of money should be devolved to the counties at this particular point in time. What will happen if you come back to the national government? You'll be going for 6 months without salaries, my friend. You're better off now. Because if you ask the workers of the Rakanidi County, the staff, they'll tell you are paid up to including last month. Forget about the fact that we are 3 months behind. I don't ask me whether manufacture money. Ni ujuzi tu, natumia kujanja hapa na pale, you can make sure they are paid. And I would like them to admit, when they are listening to me, that the Rakanidi County has paid all their staff up to the end of January.
Okay.
We may not have paid their salaries for February. It's simply because it ended just the other day and we've gotten resources. We have not gotten resources for December. So if it is for resources, you cannot afford to make that decision. I'll have one very good reason that would make the population or the people of Wajir, the people of Marsabit, the people of Turkana walk to Nairobi on foot to protest that decision to return health back to Nairobi.
Yeah.
Because before devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors who are in Turkana were only 10. Today, after devolution, the number of doctors You can call the governor of Turkana County and they can tell you that they have 70 doctors in that populous county. And therefore, they're reaching more patients. Why? Because Turkana on their own, they were able to negotiate with SRC to be given leeway, to give the doctors who go there preferential treatment in some things so that they can be able to retain them. For example, if you work in Turkana today, you are given accommodation by the government, despite the fact that you are having your house allowance. Why? Because probably if you are posted in a very remote place and you don't have a house to live in and you don't want to build a house there by yourself, then you have no choice but to come back to Nairobi. But if a government builds a house for you and you're still enjoying your house allowance, then it becomes very easy for you to stay. Okay. Turkana also gives their doctors a return ticket to go back to their home, I think once in a year or something like that, so that they feel comfortable, they can be able to go home any one time they want to go back to see their family. Okay. That is an effort that has been made by a county. Can the national government, when they are just reading from the same script in the whole county, make such a decision? Okay. Of course not. Today, we would still be having Turkana with maybe 15 doctors, and our people suffering in Turkana. If you go to far-flung counties like Wajir and the like, it's the same. Okay. And we have now facilities, equipment that people used to go all the way to Nairobi to come and enjoy dialysis, not really enjoy as such, but get treatment. That is now get at a local level. All right.
Let's talk about solutions here, gov't. For yes. I know you will have a sitting tomorrow. You'll read from different pages and have that discussion during that time. But what is the solution to simple things like lack of medicine in some hospitals in the counties?
Trevor, I keep on wondering why the governor will insist that the healthcare workers need to be in the counties or within the counties when he is also at the same time saying that they're able to pay them within 3 months or 4 months when the treasury has not released the funds. If the money for healthcare workers is coming from the exchequer, why must it go to the county accounts? Why must it be diverted to other developments before it pay the workers? That's one of the problems. We have healthcare the same way we have education and even security. The security is centralized, and the same to education. And you can see a deliberate plan by the government to have annual employment of healthcare workers. If I can ask the governor that from the county, 47 counties of this country, how many counties are budgeted on resource for employment of healthcare workers? You'll find 0. How many counties are actually having a plan, even in the whole country, to employ healthcare workers? You realize that there's a lot of back and forth between the ministry and the county governments on employment. And that's why there has not been that annual employment. And with Health Service Commission, which we have initiated a process to collect signature for Kenyans, because the Kenyans who are suffering when you don't have these services. It's the Kenyans who are suffering when healthcare workers have not been paid their salaries and they have to stop offering services. It's the Kenyans who are suffering when counties, out of the 47 counties, hold comes over 200 billion. And then they say that they need the money to pay this. When there are no drugs in the hospitals, it is the Kenyans who are suffering. A point has come where doctors go to these public hospitals in the counties just to certify deaths. Okay. And why is that happening? Because there are no equipment, there are no drugs, and there are no personnel to actually offer these services. Okay. That's why a point has come that the governors have to be very objective and look at it that this is money for paying workers. These workers moving to national does not prevent them from working in these particular hospitals. Therefore, they will have the procurement, they will have the structures, and then demand for the workers. Okay. That will be a solution that will not only help the governors or the workers, but will help the service delivery in this country. Okay. There will be a standardized way. Mudomi could be good in Tharaka Nithi, but how many other counties will dismiss doctors regularly like Kirinyaga or like the former governor of Laikipia, whereby you're faced with a lot of tribal strifes in the county, political occasions in the county. That need to change if health is to be essential and to be offered to every Kenyan. Okay.
Yes. Governor, how much should counties allocate to healthcare from their own source revenue to mitigate these issues? And what will it take to achieve the 15% of the Abuja Declaration, which we all signed?
The Abuja Declaration is at 4.4%. It is important for you to know that almost all the counties in Kenya, we have dedicated from the last State of the Country's address that we did last year, 30% of our resources to health. And that 30% that goes to health, 70% of it goes to paying health workers. Of this health workforce that I have today, almost 80% of my workers are somehow in health. And therefore, it is one of the biggest resource that we have in the counties. And I do not agree with gov't, with general sweeping statement that we don't have drugs in counties. You know, that is a general sweeping statement. You should have statistics. Because when you say we don't have drugs, it is not possible to have drugs 100%. Once in a while, you miss, even if you go to a local chemist, you can miss one of the drugs you've been prescribed to. But we don't have that a very dire situation whereby counties completely have zero drugs. When you talk about non-payment of salaries, remember, the counties do not only have health workers, they are not paid from a different payroll from the rest of the counties. So when you have not paid the guy who collects garbage, you have not paid the guy who does the roads with the grader, you have not paid the guy who is normally collects revenue at the market, they are all in the same payroll. And the situation of having delayed salaries is not unique to the health workers. It is a global problem that the economy of Kenya needs to actually be able to address, because you cannot be having a constitution that says release funds to the counties timely, and then we have resources delayed for 3 months, and you still expect the same kind of services. And if by listening to the leadership of this county, if I was not in the government today, I would have thought maybe it's sabotage. But I know it's the same problem we had with the Jubilee government. It's the same problem now we have with the Kenya Kwanza, even though I can see hope at the end of the tunnel, because I can see plans to be able to release the money, and I've been seeing why the monies are getting delayed. So the solution to this problem is not bringing back health to the national government. It is getting resource to devolve down there and give timely reimbursement so that the health workers can be paid in good time. It is important also to note that most of the health workers are happier in the counties than happier. You know, gov't is an activist. He is just talking because he needs his people to re-elect him again, which I understand. It is a good thing. But it is important to note that when you promise your people something that you can't deliver, it's the easiest way to get kicked out. So
let him finish.
So it is important for you to promise your people what you can be able to deliver, rather than give them hard-hitting statements like an activist that is going to just cause problems in the counties. And the end of the day, there is nothing. They'll tell you, gov't, why did you take us to the streets?
Trevor, you know, when he says there's no funds in the country, I almost smile over it, because it's just the priority. Because when you look at it, if you employ 0.6% of healthcare workers, then you increase the economy by almost 9%. And if you look at the 4,000 doctors that are unemployed, if you employ one doctor, it means you're going to employ 8 other healthcare workers. So employing the nurses, employing the clinical officers, employing the lab technologists, employing all this health workforce, one doctor, 4,000 doctors, and the 32,000 healthcare workers will cost this country only 30 billion. Tell me, on these budgets of trillions that we keep on seeing in the country, will they not employ healthcare workers to help the Kenyans annually? So it is a matter of priority. And the priority I'm saying is because the Parliamentary Service Commission in this country have hefty insurance covers. The governors have hefty insurance covers. The MCS have hefty insurance covers. Even the ministers, including all the ministers, have Jubilee and other hefty insurances. What then happens to the Kenyan who can't get the access health cover in those particular facilities? They will be wallowing and having to form WhatsApp groups for collection. Okay. I know of 10 families that have their title deeds retained in hospitals because they could not pay bills. Some even lost those patients. I know of families that are in WhatsApp, like now I'm in over 50 WhatsApp groups collecting funds to help people go to India because they can't get healthcare. This happens because this country, we are not investing in healthcare. We are not putting money to have functional public services. Okay. And the people that we have entrusted with the healthcare do not seek healthcare in those facilities, so they do not feel it, and they now come to the point of politicization. I want to tell you that in the financial year 2021-2022, the Ministry of Health have a budget of 150 billion for healthcare. The 47 county governments have a budget of 350 billion healthcare. Why then will as per the report, the Auditor General reports, the controller of budgets, he reports that 40% of this budget of the counties goes to the wages and to the bills. If the government are struggling with that, why can't they release healthcare workers and then be able to manage the healthcare within the counties? Okay. And then why can't then the 150 billion, which is in the ministry is for policy and programs. We have many policies here, 2017 policies, 2014, the year 2000. Policies are not valuable if they cannot be actioned to save the lives of the Kenyans.
Okay.
Yes.
Governor, in your view, what is the solution to all this?
Let me.
You started by saying that you're reading from different scripts, and it is evident you're reading from different scripts. I hope tomorrow.
Yeah, we are reading from different scripts because my friend seems to be having a fixated mind that he can get reprieve if the health is returned to the national government. I would like to remind you, and this is open secret. It is out there, and you can see it for yourself. That health workers in this county are facing the same problems that the teachers are facing. We have 30,000 employed teachers. We have engineers who are out, who have graduated from universities, who are looking for jobs. So it is a general unemployment problem because we are not being able to create systems that can be able to absorb people as fast as possible. However, on struggling in taking the human resource back to the Afya House while they operate in the counties, that is going to be a very dysfunctional system. It is not possible for Afya House to supervise staff when they are in Afya House in the villages. It is not possible for you to have one person who normally pays the piper, but they do not call the tune. It is not possible. Because if you have a worker who is being paid from Nairobi and is working in a dispensary in a village in Tharaka-Nithi, who is being supervised by somebody from the county government, who they do not pay their salary and therefore they don't answer to them, it is very difficult for you even to discipline those people. Discipline does not mean that supervising them to the extent of standing there for them to work. Yeah. It means they need to have a responsibility because their issues are being resolved down there at the counties.
Okay.
TSC, at the moment, has been struggling. They had to devolve Teachers Service Commission to the village. That is why today you have a parallel system where there is a county director of TSC who is looking over the teachers, and you have a county director of education. The county director of education usually have very little say over the teachers. Try one day to remove the county director of TSC and also the other directors down there, and you see what is going to happen to the system. Okay. For that to happen, it means if you devolve the health to the national government, you have to have more employment for supervisors down there, while the county has idle workforce that is supposed to be doing that supervision. Okay. It is simply not possible.
All right. But Governor, I need us to talk about, because we're running out of time here, there are three specific attempts that were there to somehow improve healthcare in the counties. Yes. One was the medical equipment scheme, leasing. Yes. Did that work? The other one was the Cuban doctors. Yes. Did they serve their purpose? The other one is counties did not want to be entangled with KEMSA. Has that been resolved on these three issues? Let's start with the medical equipment scheme. All right. Was that a mess? Very good. Suggests, or was it a good?
Well, a medical equipment scheme has been surrounded with a lot of mystery, just because there was no explanation on how it was perceived. But like I've said before, that is a very necessary evil. Necessary evil in that it was conceived in a way that was mysterious. I'm happy now the current administration is trying to rectify and demystify it to make it open. And that is why we are having an audit into how the equipments are performing across the county. All the 47 counties have an audit that does what we call tallying. If we had a list that says 17 equipment went to the Tharaka-Nithi County, we had CT scan, we have X-ray, digital X-ray, we have X-up, all those things. Yeah. You counter check all of them, whether they're there and they're functional before you sign or extend the contract for the lease for the same.
Cuban doctors?
Now, those equipments today, what has reduced the queues in our referral facilities like Kenyatta, like Moi Teaching and Referral Hospital, and the provincial headquarters, because it was not attainable that you can have dialysis in Wajir, that you can actually have a CT scan in a place like Marsabit, where you don't have to travel all the way to Nairobi to go and get your scan done. Now it is working. On the issue of the Cuban doctors, when we are here talking about the workforce that we are not able to afford as both county and national government, and we have Cuban doctors who have no other interest whatsoever except serving the people of Kenya, we cannot then be talking about withdrawing them at the moment, because one, as counties, we don't pay for them. Wherever it was conceived, it is good for us because I have extra workforce. Number two, they are so disciplined because I'm not saying our doctors are not disciplined, but gov't knows that his doctors, my doctors, will work in my facility in the morning, and in the evening they have another place where they go to work, and the following day they may not come to work because they are working in another facility. The Cuban doctor will always be there doing what they're supposed to be doing. We're not blaming them because we have allowed them to do it because it's allowed, because there's a certain number of hours that the doctor is supposed to work. When he's off, you don't follow him what he goes to do. He can do his extra work. He can decide to work 24 hours. But of course, the efficiency, when you work 24 hours, is not the same as one who is just focused and only works on. We are not saying that they do better than our doctors, but we are saying we need them because they're very disciplined. They are offering the services, and they're not in any way competition to our doctors. They just complement them, and I would like them to appreciate them, because Cuba produced more doctors than they could absorb. They said those countries that need them have them and pay some little money.
Okay.
On the issue of the KEMSA.
Yeah, I'll come to you, David.
That has been a nightmare. Don't get out of your seat. You're telling On the issue of the KEMSA.
Yeah.
KEMSA has been demonized because of what happened during the COVID-19. But I want to say I've seen a different KEMSA. Different KEMSA in that today, when you order for drugs, the referral rate is, before it was about you could order for drugs and you get only maybe 40% of what you ordered. Today, when you order, you get about 75%, between 50 and 75%, which is a good thing, because the acceptance rate is about 90-95. On the turnaround time for you to get your order out, it is anything between 7 and 14 days, which is also slightly good. And we have requested, we have told counties, because the drugs for KEMSA are so affordable to us, and you didn't know this until when you try to order from the private sector. We have asked KEMSA to have an arrangement with the counties so that they continue servicing their debt as they make new orders. Okay. That way we'll eventually reduce the debt, completely finish it, and we have a working relationship. The other day, and allow me to say this because it's very important, because personally I was shocked. When we had a shortage of insulin and KEMSA did not have it, I asked my people to procure from outside, because definitely we can't allow your patients to suffer because there's no insulin. One unit of insulin that we were buying from KEMSA as 200, we bought the same unit at 800 shillings, meaning that we reduced our value for money 4 times by just that, and therefore we're not able to serve patients for a long time. Okay. And that is when I realized KEMSA is a savior. It is just we need to reform it to make sure that we reduce the inefficiency, and I'm happy that the government is doing something about it, and we begin to have a new KEMSA.
All right. Yeah. Medical equipment scheme, item 1.
I think
was it a good idea? Has it achieved it?
I think that was one of the epitome of corruptions of the previous government. And if this government extends the contract of medical equipment, then there'll be participants of this particular corruption. Why am I saying this? If you have gone through the contract and through the reports of that medical equipment, it was like a push program where the Ministry of Health goes and purchases all this particular equipment and then push them to the counties. The counties, it was regardless of existing skilled personnel to operate this. And that's why many of these equipment in many counties were rusting, because they had nobody to operate them, and they were costing billions. Their cost also, some were 1 billion, and the cost that the government was buying them at 7 million, they're almost 7 times the cost. So it was just a scheme, or rather a corruption scheme, that the ministry and probably the counties, and those who signed the whole thing were involved in. And that is the same thing for the Cuban doctors. If you look at the cost that it adds to the wananchi, it's almost 5 times the cost of employing the same highly qualified family doctor from this country. And therefore, you cannot justify that you have a number of specialists in the country that are not employed, then you go and import doctors that you pay the government of that country, and we also pay these doctors, and you give them high-level remuneration in terms of where they stay and everything they do. So these two were epitomes of corruptions in healthcare that one day will be unrevealed. And that's why there's a real need. And as the governor said, that they were not paying these Cubans, so they do not care about it. But for the MES program, they were being deducted, counties are being deducted some 200 million, some 500 million every month. If we had a well-accountable Health Service Commission, then this will ensure that the Kenyan doctors that are not employed, the Kenyan nurses, the clinical officers, the technical persons are actually employed and offering services. The governor said something here, that the Cuban doctors who will be obedient or will obey the commands and everything and be at work number one, the most diligent doctors probably in the world are the Kenyan doctors. And that's why, as we speak now, so many of them were unemployed, and some specialists from the counties are leaving to go abroad. Yep. Because whenever they go to facilities, if you go to UK today, if you go to Scotland today, you'll find them to be the best doctors. Okay. So that's one thing. But the fact that there are issues that that report that people don't go to work and things are not happening in the facilities is total mismanagement. Okay. And I will say incompetency in many of the county governments. All right. The counties have not set up mechanisms for this. Okay. So they will always bring up a rumor, because you know what, why I'm saying this, Trevor? In NMS, when Dr. Luga was there was a particular structure that was put to analyze workforce, to analyze activities in the hospital. It therefore not possible to say as an employer that doctors are missing duties or that doctors are not coming on time or they're leaving. Yet we have particular procedure that ensures that a doctor who was a patient in the list, was that procedure done? If you have patients in the ward, were there clinics, were they attended? So those are the realities. Okay. And therefore there's need. Instead of us ignoring our own country, go take our money outside. I will say, because of the demands in this country as of now, we have a doctor-to-patient ratio of 1 to 16,000. This has been there since since the year began, since it began. But it will take Kenya almost 50 years to reach the WHO ratio of 1 to 1,000 doctors. Okay. And the same to the healthcare workers. All right. So we must deliberately, as people who are elected in the offices, as the country, take charge and employ healthcare. All right, I have to come to you.
No, it's critical to, before you ask what you want to ask, to correct the notion, because I wouldn't like it to go like that. You see, we, as a government, we are not in the business of buying equipments for hospitals, because that's another sector, as Basi. Our greatest concern is to make sure that people are cured. We treat and God heals. So the scheme that we are talking about, that is saying equipment or purchase, we never purchase any equipment as a government. In the previous regime, did not purchase equipment. Those equipment are leased. Yes. And the leasing is where the whole world is going. Because if you're not you can imagine a situation whereby you buy a CT scan for almost $1 billion, 800 million, all right? A county like Tharaka-Nithi today, if you took away 600 million from my development budget, that year I'll not do any roads. But if I have a leased equipment of CT scan that serves my people the same way the same equipment serves people in Nairobi, and I'm paying about maybe 30 million per year, it is cheaper for me. And therefore, it is important to correct the notion that those equipments were not purchased, they were leased, and when they expire, their period expires, others will be brought. And another very important factor you don't realize when you buy equipment, the cost of servicing them is on you. The cost of making sure that the consumables are there and flowing at the rate that you want is on you. But when you lease the equipment, it's like when you lease a car. It is not your responsibility when it goes to service, whether it has insurance. Your work is to drive and move. Okay. And therefore, it is the best thing that ever happened to our counties. The only issue is the way they were conceived that time without due disclosure to the counties. Right. Because the counties wanted to be involved in procurement, which of course the national government did not want to engage themselves in at that time. And it was a question of, why are you pushing the equipment on me and an independent person? But you see, the power of aggregation, the power of having numbers. When you have more numbers, you have a better bargain than when each one of us buys on their own. The equipment I'm talking about buying at 600 million. Okay. If today we came together about 10 or 15 counties and say, let's buy the same equipment, the cost may come down to maybe to even 500. Okay. And that is the reason behind having that collective responsibility of bringing them together.
All right. There's a lot of feedback coming through. Let me read through them really quick and then get final remarks. I'll start with you, gov't. Let's bring up the feedback real quick and see what the people are saying. At Trevor Mbija at Citizen TV Kenya, use the hashtag Monday Report, a lot of it, trying my best to go through them. Babu Michael says, will it reach a time when the health workers in this country must not issue strike threats for their issues to be looked into? Okay. Let's see what else you're saying here. They're going to have a conversation tomorrow, so we'll know. Dr. Duale Jr. says, kindly ask Mudomi why the UHC contractual workers cannot be absorbed to PNP status now, whereas counties continue employing healthcare workers on PNP terms. Our consolidated salaries don't have any allowance. Why this discrimination? Very briefly.
Well, is that my parting shot?
No. This is an answer to Dr. Duale Jr.
Dr. Duale Jr., you're lucky to have a job if you have a contract for 3 years. The contractual jobs that for UHC were born out of need when we had COVID. And I want to thank the national government because they saw it fit that time to be able to hire extra health personnel to be able to deal with the COVID. And in that makeshift of having a very quick solution, they came up with a 3 years contract, which expires in April this year. And by the way, so they're lucky because they're not going home.
Pensionable, like the doctor is asking.
It is because we are talking about having a budget in the counties to hire those people. Remember, they were hired by the national government. But the national government has agreed to extend the contract for another 3 years. Okay. So that at that particular time in the space, the county governments will have organized themselves to be able to absorb them. All right. Tell him he's lucky and he has a job. He can do another 3 years, and then eventually he's going to be absorbed.
All right, let's bring up another conversation there. gov't, I know you want to respond. I'll give you a parting shot. 30 seconds.
Yeah, you know, it's an injustice to the healthcare worker to be working in the same hospital with your colleagues, and you get half pay, you have no insurance. Even if you get sick or your family, you cannot get it done. So it comes to reality that for the county government to actually access care, the national government have to sacrifice healthcare workers in half pay. You get the point. So it's an injustice to the healthcare workers to be sacrificial lamb. And this was happening during COVID, and it's still happening. And that's why, if you look at the judgments of the court, it is discrimination to get paid half when you work the same work.
All right, I'll come to that. Elizabeth Nayoma says, I think it's about time that we have a health service commission. The evolution of healthcare isn't working at all. Without doing that, we cannot achieve universal healthcare as one of the SDGs. Okay, let's see, we bring up another thing. Arap Walter says, the day you will understand and have a conversation that healthcare is a system and not necessarily doctors' affair, then we'll be on the right track to resolving what ails it. Okay, let's see what else you're saying. Cedric says, if indeed there's a shortage, where do they get the time to spend in private clinics or hospitals at the expense of the public facilities? gov't, that one is for you.
I want to tell you, it's a notion and it's a political propaganda that is used to say that doctors work in the private at the expense of the public. I will give you an example, and this data I was sharing out recently. We have some counties that have like about 20 sub-counties, and in the whole sub-county there's one doctor who is the sub-county MOH, and the same one is expected to see patients in those facilities. There's no way you can expect to see a doctor in an hospital if you don't employ them. And that is the problem that's existing in the counties. That is,
it's true that doctors have their own private facilities, right?
I want to answer you that. If you look currently in the status that we have over 4,000 doctors unemployed. I will tell you that doctors who work in government don't even go for locums currently. I want to tell you that doctors who are specialists, who work, for example, in Kenyatta hospitals, they will always go do their procedures in those particular facilities. So it's a notion that has been engraved in our thoughts that doctors don't work in the hospitals, work in the private facilities. Tell me, if I am a med sup or I am a chief officer, and I know that this particular doctor has a theatre list to do, or he has clinic to do, and is not been in those clinics in the private facilities, what will I do? So it is, and I told you last time in a show like this, that it's a notion that has been implanted in our heads that makes people believe that, but it's not true.
Okay.
And that is because we have shortages and extreme shortages. We need to employ over 80,000 doctors.
You know, gov't is talking to patients and they're looking at him and wondering, does this man live in Mars? Because the same patients in our hospitals are referred by the same doctors to their clinics in the evening. The same doctors. So they're looking at gov't and wondering, do you live in Kenya? Because I have doctors in my county who have clinics. I can count for you 5. I have clinic officers who have been trying to do the same. Now it even got to nurses. Today I told them to make a choice between working for the county government of Tharaka-Nithi, those clinic officers and nurses, or going out and doing their own practice. Because we cannot have you being paid a full salary, and you go to the hospitals and sometimes you don't tell patients that this is where we are, you tell them, see me in the evening in my clinic. I mean, it's not justice for people, and it is good to accept that.
If you look at the Nego Commission report of 1971, where previously health was actually devolved.
Okay.
But through that commission, it was not working, and the commission recommended for health to be centralized from the councils. That commission realized that the healthcare workers were getting meager wages, like the doctors currently, and every other public servants are getting meager wages. And therefore, that commission gave healthcare workers the right to work in the facilities, but also the right to offer services beyond that.
Okay.
And that's why currently there's a bill, I'm saying, in the parliament, that they're saying the conflict of interest bill. The only thing that will happen with that bill is that once it is put in place, the government must invest in healthcare to have even the consultants in those facilities. Otherwise, that may be the end of the public healthcare in the country.
All right, let's go through the feedback and see what you're saying as we wind up on this. Then I'll come to you. What Okelo Mwalimu is asking is actually what should be gov's parting shot. What next? Okelo Mwalimu says, what does Governor Njuki think of the proposed creation of the Health Service Commission? To KMPDU Secretary, what are they doing to end perennial industrial actions? And there are better ways of airing their grievances. We'll come back to that in just a bit. Let's see what else you're saying here as we wind up on this conversation. Crispus Kinywa says, please ask the governor to hire nutritionists too. Many are jobless, yet there are huge gaps, okay? Let's see what else you're saying there. Extremely Dennis says, there seems to be an acute funding issue for healthcare. A long-term solution is required. The county needs to be strategic and consider doing medical tourism as a funding solution, okay? And Babua says, perhaps you can ask Bwana Governor when he last employed a medical doctor, and does he know the gap he has in his own county? Yes. All right, let's see what else you're saying here. Ken John, just like TSC serving teachers, we have police being controlled and being recruited from the Ministry of Interior. Why can't we have our medical practitioners being controlled from a central body nationwide? I believe it must not be county government. All right, gov't, closing remarks. Now there's going to be the conversation tomorrow. What next? If that doesn't happen, if that happens and there's no solution, what next?
You know, I want to tell you today, the healthcare workers in this country, as the doctors, the nurses, the clinical officers, even the morticians, they don't enjoy going on strike. All the healthcare workers enjoy going to the hospital and working. And that's why we gave an intention to strike in December. And by having a meeting with the Council of Governors, with the ministry and with the labor, we decided to suspend that particular strike. That was a show of a goodwill and a show that we want to offer the services. But as I told you earlier, the court gave a judgment that the CBA 2017-2021 to be implemented in 60 days from October 2021. We had a meeting 460 days later. And we sat with the Council of Governors, we sat and discussed and agreed we will count the 60 days afresh from 4th of January to then yesterday. We have not been given any interim reports to the progress of these particular issues that were to be solved. Because, as I said earlier, the issues that we've been mentioning here, including the Health Service Commission, including the public being able to get drugs in the hospitals, were part of the CBA and part of the things that we're demanding. It is not the role of the doctors to go to the hospital just to supervise deaths and to satisfy that somebody has died, but to offer services. Okay. And therefore, if we had this meeting tomorrow and we don't get the framework that the government, both the national and the county, are going to implement the collective bargaining agreement that was signed, it means that we cannot disobey court orders the way they've done. We'll have to proceed on the industrial action as contemplated by the Honorable Judge. Okay. And that will be the direction.
All right. Yeah. Governor, closing remark.
Well, financing health is a headache, not just for Kenya, but all at large. And one of the solutions we are offering as counties today is to ring-fence the funds that have been collected from the health facilities to ensure that they are plowed back in the same health facilities. Because when the health funds that are collected from facilities find their way back to the exchequer in Nairobi, which is the CRF account, sometimes when that money is taken back to the county, it does not necessarily end up in the facilities. And therefore, there is a law that is being passed by county governments. It is called Facility Improvement Fund. 25 counties out of 47 counties have already passed it. And we're hoping by the end of this year, all the counties will have passed the same, so that all funds collected from facilities find their way back there and take care of the gap. And when we do that, plus ensuring that we have a comprehensive health cover for people, and we have more NHIF funds going back to our public facilities vis-a-vis what is happening at the moment, where you find almost 75% of NHIF funds go to the private sector because of the situation that we have in our public facilities. Then we will be saying that our health sector is gaining some form of independence, and that is where we want to go. Okay. Thank you.
All right, thank you so much for making time this evening. His Excellency Mudomi Njuki, the Governor for Tharaka Nithi, and also the Chairperson for the Health Committee and the Council of Governors, and Dr. Davji Atela, KMPDU Secretary General. They're having talks tomorrow. We'll keep you updated on how those talks go by, all right? Thank you for tuning in to Monday Report. My name is Trevor Mbija on behalf of the entire team that made this possible. It's good night and bye for now.